Nutritional Dilated Cardiomyopathy. Where are we now? I'm Dr. Deer, a small animal emergency veterinarian, and let's talk about the latest research. Let's start with, what is dilated cardiomyopathy? DCM stands for dilated cardiomyopathy. This is a disease in which the ventricles of the heart dilate, leading to difficulty for the heart to do its job pumping blood. Symptoms develop because the body is not receiving enough oxygenated blood, or because of congestion of blood in the lungs, or both. Clinical signs include weakness, lethargy, weight loss, collapse, trouble breathing, cough, increased respiratory rate and effort, abdominal distension, and sometimes sudden death. They can also have cardiac arrhythmias secondary to the damage to the wall of the heart. Diagnosis of DCM is typically done via echocardiogram, which is an ultrasound of the heart. X-rays can show an enlarged heart, but it doesn't tell you the pathology behind it necessarily. They can also put a Holter monitor on, which is a long-term monitor that goes on your pet, to look for things like arrhythmias. Treatment involves medications to improve the ability of the heart to pump, as well as dilating peripheral blood vessels to decrease workload on the heart, and then also medications to get the fluid out of the lungs if it's present. DCM is not curable and is typically seen in certain breeds that have a predisposition to it. So how does this differ from nutritional dilated cardiomyopathy? Nutritional or atypical dilated cardiomyopathy is caused by nutritional deficiencies that end up leading to the abnormalities that cause dilated cardiomyopathy. And in cases of nutritional DCM, it's actually been seen as reversible, which makes it so much different than just typical dilated cardiomyopathy, in which you cannot reverse and cannot necessarily cure, even with things like medications. With nutritional dilated cardiomyopathy, we're seeing some of these patients go back to normal with things like diet change and medication. But I'm getting a little bit ahead of myself. I want to start by going through the history of nutritional dilated cardiomyopathy. This history is important because it'll show us how we got from, wow, there's a lot of these cases of dilated cardiomyopathy being diagnosed in breeds that we don't typically see it in, to the recommendations we have today. Hopefully it can kind of help you to understand how we got here. If you want more information on this, there's some really great resources. Dr. Holly at All Trades DVM has an entire timeline on her website, and then Emily at the Canine Review has done some amazing work into digging deep into this. Tufts also has the Pet Foodology blog, which is absolutely amazing for any nutritional needs you have for your pet or any questions that you want answered by professionals. So where did this all start? In the mid-2010s, veterinary cardiologists and veterinarians in general were noticing an uptick in this dilated cardiomyopathy in breeds that were not typical for the disease. As such, veterinarians started reporting this to the FDA, and they started to collect some data in about 2014. By the time 2018 rolled around, the FDA released a statement that basically said, hey, if you have these weird cases of dilated cardiomyopathy, can you let us know? They also included things like questionnaires so they could get a better idea of where this DCM was coming from. Why is it suddenly being diagnosed at a higher rate? December of 2018 is when we had a prospective study where 24 golden retrievers with DCM and taurine deficiency were evaluated. 23 of the 24 were fed either a grain-free, legume-rich, or a combination of these diets. None of these diets were feed trial tested, which is really important. 23 of the 24 dogs had improvement in echocardiogram and normal taurine concentrations following diet change and taurine supplementation. 9 out of 11 of the dogs that were diagnosed with CHF had resolution of congestion, and 5 no longer needed diuretics at all. This started a deep dive into the idea that taurine may be the underlying cause of this, or taurine deficiencies. We know taurine deficiency can lead to DCM. We saw it in the 1980s and 1990s with cats, where a ton of cats were being diagnosed with DCM, and we really didn't know why. It was found that taurine deficiency was the culprit, and supplementation of taurine saw improvement in many of these cases, though some of them were too affected and ended up passing. Since then, a lot of the recommendations around cat diets have changed. In June of 2019, the FDA released its first huge update, revealing that 515 dogs had been reported as part of this initial case analysis. They created a list of breeds, brands, and ingredients within the report, as well as a PDF that had all of the complaints. You can now find this through archives. This caused a lot of controversy, and we'll talk about that a little bit later. There was a common denominator. All of these patients were on a grain-free diet or something called a BEG diet, which is boutique, exotic, or grain-free. And these diets had high proportions of peas, lentils, or other legumes, pulses, and potatoes. Despite this, there was no obvious mechanism to explain why this was happening. Now, I want to take a little bit of a pause from the research to talk about the pulse growers associations. From 2019 to 2020, a lot of these pulse growing associations and lobbyist groups started to talk about how this is going to hurt their bottom line. One thing that they were worried about is that about 10 to 20% of pulse crops go to dog food. And so if grain-free was suddenly going to be an issue where owners are no longer going to buy it, that was going to affect the bottom line for a lot of these companies. There was a newsletter sent out from the Northern Pulse Growers Association outlining their efforts to urge the FDA to stop giving updates. In May, the Pulse Pipeline announced that they were donating to BSM Partners, which is a pet formulation group. Their goal, direct quote, BSM is asking for $5 million to conduct 3 important research projects that have the potential to discover the true cause of DCM in dogs and take the heat off grain-free diet ingredients. As we move through 2020, we see more efforts from the grain and pulse producers to silence the FDA. Columbia Grain Internationals announced a $25,000 donation to BSM. In September, 7 senators wrote to the FDA urging them to be impartial. There was an upcoming symposium that was going to happen at the Kansas State University around things like this nutritional DCM. It was put on by the FDA as well as industry, and they were giving presentations about this diet-associated DCM. The senators urged them to be impartial, saying, "We are asking for your assurance the FDA will ensure the symposium is organized in an objective manner and that the best available science is made available and examined so as to prevent any bias without causation of this disease." Plus, there were some comments about stakeholders wanting the underlying medical records for these reported cases. In June of 2020, BSM released its first literature review, claiming that they analyzed 150 plus studies and saw no link between diet and DCM. This was immediately dismissed by sources such as VIN and the Canine Review. And this could start a really big deep dive about conflict of interest statements in studies, but I think VIN and the Canine Review did an amazing job of talking about it, so I'll leave those links here. Now, let's go back to the symposium that took place at Kansas State University. In this symposium, the FDA admitted that the current complaint list was up to 1,100 dogs. It also included a presentation detailing recovery in cases that underwent diet changes. This was one of the first times that we saw that these cases that had been reported were actually improving with things like diet change and medication. Remember, with dilated cardiomyopathy, there is no cure in the genetic cases. And these nutritional cases, when we were seeing improvement with these diet changes, that was telling us that diet is probably the underlying issue. And this was backed up in a study from December of 2020, which was an observational retrospective study that showed that changing a dog's diet from eating a non-traditional food was associated with significant increase in mean survival time and reversal in some patients. So we had the symposium results from the FDA, and now we have this other study showing improvement with diet change. As we got into 2021, several more studies showed everything from higher levels of cardiac troponin 1 on grain-free diets to length of time on grain-free diets being associated with worse outcomes in these nutritional DCM cases. Still, the exact mechanism was unknown. There was a foodonomics research out of Tufts in August of 2021 that shed light on a possible underlying etiology. There were unique, unnamed compounds that were in diets that had greater than 3 pulses, which were not found in diets without those pulses. They also found that diets that had greater than 3 pulses in them had nutrient deficiencies and excesses, and peas seemed to be a big culprit ingredient. In March of 2022, BCM released its second study, which was a survey study. Basically, what they did is they looked at the incidence of DCM in overall populations and compared it to the rise in the sale of grain-free diets. Their argument was that the levels of DCM in the population had not increased even as the sales of these grain-free diets had increased. As with their first release, this was met with a ton of backlash. They only collected responses from 14 hospitals, and they ignored major referral centers or places that were recruiting known nutritional DCM cases. The media, however, ate it up and reported no link between the two, despite the fact that it was a very flawed study. As 2022 continued on, multiple new studies are published. Some showed improvement in biomarkers when switched from a grain-free to a grain-inclusive diet. Some found that feeding a pulse, legume-rich exotic protein diet was associated with decreased red blood cell count and increased serum phosphorus. In December of 2022, things really started to get interesting. The FDA quietly released on the 23rd of December additional data showing the cumulative number of reports of nutritional DCM was now at 1,382. They also create a statement that was then misrepresented across media. The FDA does not intend to release further public updates until there is meaningful new scientific information to share. And while adverse event numbers can be a potential signal of an issue with an FDA-regulated product, by themselves, they do not supply sufficient data to establish a causal relationship with reported products. The media amplified this message. Even the AVMA ran a now updated article about this, claiming that the FDA found no association and that it wasn't going to investigate anymore. This obviously was not true, but it set off a lot of issues in the media. In that exact same month, December of 2022, a study compared echocardiographic measurements and cardiac biomarkers between healthy dogs eating a non-traditional diet and healthy dogs eating a traditional diet. Healthy dogs on non-traditional diets had lower indices of systolic function and left ventricular volumes. In February of 2023, there was a major study that investigated nutritional DCM in cats, ones that were fed high and low pulse diets, and they did not find a significant association with cardiac size, function, and biomarkers. But they did note that the high pulse diet cats tended to be overweight. This was one of the first studies that really looked at cats with nutritional DCM and didn't find a super compelling link when it came to grain-free foods. February 3rd of 2023, there was a Freedom of Information Act request by Susan Thixton at Truth About Pet Foods from the FDA. In April of 2023, Emily Brill at the Canine Review files a Freedom of Information Act of the DCM cases. Dr. Hawley together to create some excellent charts, which I'll link here. In May of 2023, a study funded by Champion Pet Foods was released, basically looking at Siberian Huskies, and claimed that there was no change in BNP or echocardiograph parameters in dogs fed a high pulse diet for 20 weeks. In May of 2023, BSM released a study showing beagles fed high P, high amylose diets developed DCM-like changes on echo after only 28 days of feeding. Remember, BSM Partners is the group that the Pulse Growers Associations got together and funded a lot of money towards in order to disprove the link between grain-free and DCM. In June of 2023, the U.S. government released a bill stating that canine dilated cardiomyopathy. The committee encourages the FDA to refrain from issuing statements, bulletins, or advisories linking canine dilated cardiomyopathy to certain pet food ingredients unless new information is available, such as completion of adequate, peer-reviewed scientific studies or publication of the proceedings from a scientific meeting or colloquium. Now, think of how many studies I've mentioned, and I'm not even including all of the ones that have been looking into nutritional DCM. Keep that in mind while you're listening to some of these things that were going on the government side, trying to get the FDA not to talk about this topic. In July of 2023, there was a study where pit bulls with DCM had improved echocardiogram findings after switching to a traditional diet if they were initially on a non-traditional diet. In October of 2023, BSM releases another study of 55 dogs. The diet groups were as follows. They had a high animal protein grain-free diet, a low animal protein grain-free diet, a high animal protein grain-inclusive diet, and a low animal protein grain-inclusive group. Cardiac-specific biomarkers and endomyocardial biopsies and linear and volumetric echocardiogram parameters were evaluated. In the end, no cardiac dysfunction parameters were measured. However, they admitted several limitations in the study, including increased sympathetic tone during exam, hydration status, sampling only the right ventricle and not the left, which is where we tend to see changes with dilated cardiomyopathy, and not using echocardiographic parameters such as E point to septal separation and spherical index. In February of 2024, a pet food company called Keto Naturals starts a lawsuit against Hills and several prominent researchers behind nutritional dilated cardiomyopathy, basically purporting that they used a shadow network of veterinarians to advise against feeding anything other than Hills. In this lawsuit, they claimed that Hills was not doing well in sales, and so they invented this issue of nutritional dilated cardiomyopathy in order to sell more pet food. This was particularly dangerous because not only were they suing Hills Pet Food, they were also suing researchers at veterinary schools. In May of 2024, 97 Irish wolfhounds undergoing routine echocardiograms at dog shows between October 2018 and May 2021 were evaluated. 17% of dogs that had high pulse diets had VPCs versus just 2% of those dogs on low pulse diets. In October of 2024, a study was released looking at dogs with nutritional DCM and found that they had electron microscopic changes suggestive of abnormal lysosomal accumulation of phospholipids, consistent with the appearance of drug-induced phospholipidosis in people and other animals. This supports the possible presence of a primary or secondary phospholipidosis in dogs with nutritional DCM. And this was pretty significant because every study we have gets us a little bit closer to the exact mechanism in which this damage happens. And if we can do that, if we can find that exact mechanism, we can take a step back and see what can we do to prevent that. Is it diet side? Is it pet side? What can we do? And for one of the last updates we had from 2024 was November, where the Keto Naturals lawsuit against Hills was thrown out. That was a doozy of a timeline, and that's a lot of information to look through. So where are we now? At this point, there's likely a myriad of causes coming together to create this problem. If we compare breeds from the Freedom of Information Act, we see that certain breeds are more predisposed to nutritional DCM. The question though is it because these breeds are more popular, or is it because they have genetic predispositions to this? For example, you'll see that golden retrievers and Labrador retrievers are really high on that list of breeds that are affected. They also happen to be very popular breeds in America. Mixed breeds is also a top breed that's affected, and again, a very popular breed in America. However, certain diets continue to land at the top of the list of implicated diets. We also know that diets high in pulse legumes, like peas, lentils, and chickpeas, are implicated the most. What about grain-inclusive diets that use legumes? I'm going to quote the recommendations from UC Davis Veterinary School here. While avoiding all suspect ingredients may be the most direct way to select a new diet, we suggest that a small amount of legumes content in a well-formulated grain-inclusive diet may be okay. Our guidelines allow for no more than 2 legume ingredients in a grain-inclusive diet when found low on the ingredients, below all meat and grain content. Importantly, these diets should still be tested by AAFCO feeding trials. One point that I want to make, and I think UC Davis is trying to make as well, is that diets that are well formulated, that are WSAVA compliant, did not seem to appear in these lists of diets implicated with nutritional DCM. There's probably a lot of factors involved in that, but one thing that I want to point out is WSAVA guidelines. WSAVA is the World Small Animal Veterinary Association. They do not approve dog foods or anything like that, but they do have committees that come together to create recommendations when it comes to things like dog food, nutrition. They also do things like vaccines, gastrointestinal. It's kind of an overall body. And they came out with these guidelines that they suggest you look into when you're trying to decide if you should feed your pet a certain food. These guidelines are not easy to look into, and they're pretty involved. So I always point owners towards the Pet Nutrition Alliance and their right to know status. Basically, they went and asked all the pet food company these questions to tell you if they're WSAVA compliant or not. So if you have a question about the specific diet that you're feeding your pet, please check them out and look through and see if they follow these guidelines for WSAVA. I have included some screenshots that include lists of different diets, and these may change in the future. If you're feeding these diets for your pet now, I think it's a good idea to talk to your daytime veterinarian to discuss any concerns that you have or questions you have about your pet. Not every dog is the same, and your dog is not the same as a dog in a study or a dog on a paper. I hope going through these studies and giving a timeline helps you understand how we got to the recommendations that we're at right now when it comes to nutritional dilated cardiomyopathy and grain-free diets. And I hope it helps you to understand why most veterinarians don't really recommend grain-free diets for this reason. Nutritional dilated cardiomyopathy isn't the only concern that most veterinarians have with grain-free diets, which is why I think it's so important to talk to your veterinarian about your pet. As always, I'll keep you guys updated as anything new comes out, and you can check my Instagram, my TikTok, or my threads where I post new studies as they come out and discuss them. See you next time.